Parents, I'm Dr. Dhanvi and welcome to my channel 7 Sky Child Rehab. Today we are going to see about the types of behaviors, the common behaviors in autism. So beginning with the first and the most important behavior which we commonly see is the stimming behavior. Now what do you mean by stimming? Stimming means a repetitive patternistic behavior which a child does. That is called as stimming. Now there are various types of stimming. Depending on the child's needs, the child will do that particular kind of stimming behavior. So common example which I will give you is the visual stimming. The child will constantly do hand flapping or the finger movements, or the child will be too much attracted to see the rotating things like rotating fans or any rotating objects. That is all visual stimming behaviors. The second most important stimming behavior is the verbal stimming behavior or the vocal stimming. So what will happen in this kind of behavior is the child will be constantly doing certain kind of sounds, that is that kind of sound, or if he or she knows some rhyme or some song, then constantly they'll be singing that particular rhyme or that particular song. So such kind of sound, if the child is constantly producing or the child is singing constantly, then this can be a verbal seeking behavior. Now there can be vestibular stimming behavior. So in vestibular stimming, because vestibular system is regarding the movement, right? So now in this, the child will be too much into spinning. So the child will keep on spinning round and round, or the child may like rocking too much front, back, side to side anyway. So rocking, spinning, sometimes jumping too much. Those behaviors are vestibular stimming behaviors. Now there are certain seeking behaviors also which you see. Sometimes the children are a tactile seeking behavior. So what we will see in that is that the child will take the dabba of the rice or cream or powder and they will constantly play with that, oil, any such substance, foam, or they will take that and they will rub their hands into it. I have even seen the kids, they will rub their sole, the feet, on certain surfaces. They will keep on rubbing and taking that sensory input from various surfaces. This is the tactile seeking behavior. Now coming to the oral seeking behavior. Now oral is relating to the mouth area. So what will happen is the children, they will take all the things and they will put it in the mouth. It can be paper, it can be pen, it can be tissue, ball, any such thing. They will take and they will put it in the mouth because they are seeking that oral inputs. So whatever comes in their hand, they will try to put it in the mouth. Lot of mouthing you will see. This is a oral seeking behavior. Now, if you see that many small kids also, in the infants, in the toddlers age also, they will try to put everything in the mouth, whatever comes in their hand. That is a normal behavior. If this continues after a particular age, and then you notice these things along with the other signs also, then this is a oral seeking behavior. Now it is the olfactory seeking behavior. Olfactory is regarding the smell. Now, what will the kids do? They will take each and every object and they will tend to smell each and every object. It can be a block, it can be a ball, it can be a small toy, a car, whatever it is. They will smell everything. So that is the olfactory seeking behavior. Now other one is the pressure seeking behavior. Now in the pressure seeking behavior, what will happen is that the child will be too much into like grinding the teeth and taking the pressure here. The other thing which you will see is that sometimes the child is doing something, he is sitting, he is busy in his own work, and suddenly he can come, he will hug his mother tightly, or if any other guest is sitting in the house, he will go and hug the guest very tightly. All of a sudden, if such thing comes, then this is a pressure seeking behavior. He is seeking that pressure from the external environment. So in order to gain that pressure, those behaviors are coming. So that is a pressure seeking behavior.
So parents, that's all for the behaviors. Now in the next video, we'll see about the causes of the behaviors. So please stay tuned and don't forget to hit the like button if you have liked the video.